gets the checked by if they have any vaccinations. Also, they get checked to see if a screen actually for tuberculosis. That's important to know, so that way we'll prevent that. We prevent from spreading infections. We do surveillance every day. Everybody's responsibility as well to do the surveillance. From sometimes I think some of you have, if you have had your loved ones or yourselves gone over to healthcare, been as a resident there with us for a little bit for rehabilitation, you probably have seen me asking questions like, when was your last vaccinations? Thank you. Oh, I don't know. That's malicious. Okay. When was your last vaccinations, like the pneumonia, the flu? When was the last flu shot you had? And actually also screen you for tuberculosis. So those are our responsibilities to making sure that we spread infections among ourselves. Hand washing is always every single day for our staff, making sure that they do wash their hands correctly before they take care of you or your loved ones. I'm sorry, I'm waiting for Felicia for a minute. We'll go over standard precautions. We can go over standard precautions. Standard precautions is like what we call that we do actually the precautions. We look at everybody's potentially infectious. Can be from a 0 age to 100 plus age. We all potentially infectious. I'm sorry.
I just wanted to make sure y'all got to see me again, you know.
Thank you.
Sorry.
Thank you so much. Okay, okay, good. So standard precautions, once again, let's go over that. We look at everybody as a potential infectious. Enhanced precautions, I was putting more than that. Let's say, for example, a person needs to be put in isolation. That's more than this, just the standard precautions, meaning that the staff will wear their personal protective equipment before they get into the rooms to care for a particular resident. And there's another one too as well now that they just came up a few years ago. It's called also enhanced barrier precautions, meaning that it will be if a resident has any wounds, any incisions, any catheters, any open areas on their body, they will be also protected. And now that's protecting our residents from us. The caregiver will protect the resident from them. And to know that, let's go a little bit about what it is an infection, how the infections get transmitted. The first thing that we do need is infection. We need an infection agent, which will be a virus. It can be a parasite. It can be any germ in there. Fungus as well. And then the reservoir, the habitat for the organism to grow. It'll be ourselves, human beings. If we have an open area or any impairment on our skin, there's potentially a chance to get an infection. So it's a reservoir. Animals, air, food, soil, water, and equipment. Equipment also, fomite, anything that we touch. It can be a potential transmission of infection. It might be a germ there that I touch and I take it to myself. Okay. We also need a portal of exit, which will be the secretions, saliva, urine, feces, any excretions that we have. How do we transport our germs? Usually our the mode of transportation is through our hands. We touch everything. I keep on telling my 7-year-old, do not touch anything when we go to the stores. Please don't touch. But she does it. She does, and like, okay, well. Then after that, you know, your hand sanitizer, do it then. There's nothing. I mean, she doesn't get it to her head that not to touch everything because everything is touch. So we have those. Germs don't fly, don't have wings, so that we do transport them through our hands. So that's the vehicle or mode of transmission. Portal of entry. How do they get in there? Well, we said that already. We have our mucous membranes that are very easy to get anything in there. So we touch our nose a lot. I mean, it's a number actually that they tell you that how many times we touch our noses because it itches, because of whatever, and it's just that. So mucous membranes, an open wound, oral. Sometimes we forget to wash our hands and we ate whatever germ we get. Sometimes we get sick, sometimes we don't. So that's a good thing. Respiratory tract, when we had pneumonia, any other those things. Urinary tract, of course. Moreover, it's more at risk when you have a catheter inserted in there, so the chances of infection are even greater than that. Now, then we need a susceptible host, a person that is their immune system is depleted. Therefore, you are a host, I mean, susceptible. You're susceptible to catch anything, maybe because of whatever comorbidities you may have, illnesses that you're suffering, taking some antidepressant medications. Those are put everybody susceptible to an infection, and how to fight it too as well. So now that we know about the chain of transmission, now we need to know how to get rid of that, how to break that transmission. And it'll be by, does I tell you that, elements to get rid of germs. Germs do not only live in the laboratory, but are in our everyday world. And then to get them off our hands effectively is by needing water, lather, scrub, rinse, and dry in that order. I want to make sure. It is important to know the order because sometimes we would reinfect ourselves without thinking. For example, if we are washing our hands, we did everything right, but then we touch the sink trying to clean it up. Well, we just reinfected ourselves. Whatever we got out of our hands, we just pick them back up. So we need to make sure that we do not do that. We are less going like this. A lot of us do this, like with the water, and then it splashes all over. So then our head is like, oh, I got to clean that water because my mother told me to do it. And like, oh yes, so then I go ahead and do that. So then we reinfect ourselves. So just think about making sure that we don't fly too much our hands. We got to make sure also to kill the germs, not people. And really, germs kill people if the person is actually depleted. I have a short video that I can show you there, and it will to go over our hand washing. Okay. That's not my stomach.
Learning objectives. You will be prepared to demonstrate effective hand washing techniques. You will learn to identify when hand washing should be utilized in a healthcare setting, and you will understand the difference between proper hand washing and using hand sanitizers. Goals and outcomes. Students will be able to perform basic hand washing techniques to prevent the spread of nosocomial infections within the hospital setting. Students will be able to state when they should wash their hands in the healthcare setting, and students will be able to explain proper hand washing techniques versus antiseptic effectiveness. Pre and post individual patient contact, post glove removal, after using the toilet, post coughing, sneezing, and blowing your nose. up your sleeves and let's get started. Apply enough soap to cover your hands completely. Wash hands for a minimum of 20 seconds. The CDC recommends singing happy birthday twice. Notice the multiple rubbing methods, vigorously rubbing the hands together, creating friction, and using the fingernail rub.
Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, dear. Happy birthday to you. Happy birthday!
If there's no sink available and you have no choice but to use a hand sanitizer, you have to use enough of the product so that it takes 15 to 20 seconds before it's actually rubbed into the hands. The CDC also recommends using a hand sanitizer containing at least 60% alcohol. Don't touch dirty surfaces with clean hands.
Right. I really like this. I really like this video because it really brings things to home to our staff, not only to the staff, to anyone that wants to learn about proper hand washing and why is it important. It is important to keep everybody's health, ourselves too as well, because when we are taking care of someone, or we are touching surfaces that might be sticky or wet, we don't know what's there, so we got to make sure to provide the right hand washing. So you'll see me around in the facility, going around and looking. Sometimes people say, like, you really don't do your round, you really don't look around. I do, actually. I do have to make sure that everybody is safe, everybody is healthy, that there's not a chance that someone will get an infection. That also includes our staff. Our staff that comes, perhaps, and we understand about when they need to work, but they are coming with an infectious, something that can be transmitted to others, like maybe a cold sore in their mouth, an open area on their hands, things like that. They need to know to cover that, or maybe they cannot be working until that heals. So those are things that we'll look into, making sure. We offer the clinics too as well, the flu vaccines, pneumonia vaccines, all those clinics that we put up out there is for everybody's benefit. Every year we do announce it. If you have not had your pneumonia 23, please come over and let us know. We can set up a clinic. The flu vaccine is still going until March 2026. We have some flu vaccines available for you all if you want to take advantage of that. Do you have any questions? Yes, sir.
You said I had a medical interest in tuberculosis for a long time. You said you screen for tuberculosis. There are several ways to do that. What method are you using when you say you screen for tuberculosis?
Very good, thank you. Thank you. Yes, the screen that we use is the Mantoux test. Is just introducing the tuberculin. Oh, thank you. Introducing a tuberculin solution into your body. It is an intradermal.
Yep.
And if you and then we wait about 48 to 72 hours for the results. Now, let's say, for example, you react to it. It might be a red area. It has to be more than 10 millimeters long or big to see that you perhaps were exposed to tuberculosis. Some people tend to rub it, so that causes a false positive. So we have to see that. We have to see if it's flat or if it's raised. That will determine that maybe we need further evaluation, perhaps an X-ray, or we contact the doctor to see what else he wants us to do. We also refer our staff in those cases to Metro Health to be evaluated.
Traditionally, it's the induration, the thickening of the skin that has been the most reliable result of the Mantoux test.
That's correct.
There is what they call a gold test, which can be used, but that's going to be done by whoever evaluates it downstream if the Mantoux is positive. I don't believe you test incoming residents by the Mantoux test, I don't think.
We do the Mantoux test.
For the residents?
Yes.
I
We do
didn't have
include
one.
the TB test, yes.
I did not have one.
Okay. That's a good question. Oh, for if you are admitted to to healthcare,
Oh, okay.
I'm so sorry, I do apologize. If you are admitted to healthcare, because the regulations are different in our setting. Every single person, there's CMS mandates that we monitor you, that we test you for that. That also we offer the flu vaccine. That's one of the mandates, the flu and the pneumonia. Doesn't even. Any other question?
Just on a personal note, and you're talking about germs, I think all of us have a habit of going into our refrigerators and taking our hands and getting ice out. That is extremely, extremely dangerous. And I would suggest that you use a scoop every time, every single time, and take the scoop out. The scoop is clean, but germs, and it's something we all do.
Yes, that's not a good way to get to lose weight. Believe me. No, diarrhea doesn't help. Any other questions?
Do people that go to assisted living get a TB test too?
That's correct. Yes,
As well as
assisted living
healthcare?
and healthcare. Yes, that's correct.
The other question I have is, I walked into somebody's room in healthcare that was in isolation, and I didn't realize that I'm in isolation. And I went outside the door. I didn't see anything on the door, but there was something to the left.
Yeah, that's
And I didn't, it was small, and I didn't see it.
We try, and actually we have a sign outside the rooms, and that's for two things. That's for the isolation, the residents actually in isolation, and the cart supposed to be outside with all the personal protected equipment. So that way, that kind of cues you to put that on before you go in there. Sanitizing our hands and start putting our gown on, mask if you need to put a mask on, and gloves.
Okay, there was a little card outside, and it was kind of clear, so I didn't notice it that either.
Okay.
So I just
And sometimes
just
it
a
happens.
comment.
It happens, but it might be a reminder that to put it on because it's for your protection, for everybody's protection. Yes.
I just wanted to say that the archangels visit the patient rooms, the resident rooms, every afternoon for juice cart. And the archangels recently went through infection control refresher, kind of a reminder about hand washing, using either the soap and water or the gel coming in and going out. So the archangels have had that refresher as well.
Yeah, thank you.
I was wondering if we have hand sanitizer inside the healthcare rooms or out. Don't see it outside.
They are inside.
It's
Every
inside.
room, inside the rooms, yeah. And because once the staff has care for a resident, they take the gloves off. If they are not particularly soiled, they can actually use the hand sanitizer. It's effective. We do use the appropriate concentration to kill bacteria. However, there is some exceptions that they will not be using hand sanitizers. They are encouraged to use hand washing.
Okay, so as a visitor, when you go in, we can access that hand sanitizer, and when we leave, we can do it also.
Definitely.
Okay.
Definitely, yes.
Hello, everybody. I wanted to make mention that we do have hand sanitizer stations throughout the community, and they are filled at this moment with hand sanitizer. In addition, the housekeeping department routinely wipes down all of the handrails as well as the elevator bays each and every evening with an antiseptic sanitizer. So please know that housekeeping is doing all that they can as well each and every day to keep everyone in the community safe.
Hey, Enrique, I hate to put you on the spot. I wanted to ask, there's a lot of unclarity around the use of antibiotics. I know we have an antibiotic stewardship program where we try to make sure people don't get overly prescribed antibiotics, but what kind of guidance would you give if somebody gets a sinus infection? Will it go away on its own, or do they have to take antibiotics? Because I know it also impacts your gut flora and throws that off for quite a while.
That's true. That's
How would
true.
you answer?
Thank you. And yes, definitely, when you are taking antibiotics, the doctor has prescribed for a reason. You want to make sure that is the appropriate reason. Every resident that comes in with antibiotics, an order for antibiotics, we do check to make sure that it's appropriately prescribed. It's important to know that because, yeah, a virus is not going to be killed by an antibiotic. We know that already. It's something that's on the air. The air, it has to go by itself. It has to go. It takes its turn and get out of our system. But when it causes a fever, that's a thing that, okay, well, no, that's different. That, yeah, perhaps antibiotics are be appropriate. Now, I need to make sure that I did take all my antibiotics how the doctor prescribed it to me. If they prescribe it to me for 5 days, I take it for 5 days. If 7 days, 7 days. When you start taking antibiotics and like I feel better the next day and you stop, then you are causing that organism to become resistant to that antibiotic. And then when you need it, really need it, it's not going to work. And then you're going to get the big guns, big antibiotic guns, we may call it that. The ones that are methicillin-resistant organisms that really have to have this special antibiotic, and it's bad for your system. What causes a disruption on your intestinal flora, and then you have this diarrhea going, and it kills your good gut, good flora, and it's an overpopulation of the bad flora, so now it takes over. And as I said before, that's not a good way to lose weight. People think like, okay, well, just try some weight out. No, it's not good because you also are expelling your electrolytes, so you're at high risk for dehydration on that part. So it is important that, yes, you do make sure that we get treated for the right reason, and we do check that to make sure that everybody's in the right medication and right antibiotic for the right reason, and we make sure that the course is completed. Okay? Thank you. Yes.
So I use the stairways every day. Do the housekeeping people clean the rails in the stairways?
Yes, they do. They do. Housekeeping is responsible, that we have certain housekeepers responsible for cleaning all of the common spaces, to include disinfecting the handrails and any other spaces that are frequently touched during the course of the day. They're wiped down every day and every evening.
Any other questions? You have a flyer that we gave out. It's about, and as you know, we are in the flu season. The flu season comes in till from perhaps since last September. It starts in September usually to March. That's usually it is. Yes, sir.
Guess I go back to Doug's discussion about TB. And isn't TB picked up with a normal X-ray?
Well, it is, but that's not the preferred for healthcare. That's not the preferred method of doing that. We need to do a actual TB, so to insert this TB solution. If there is any question, let's say for example you have tested positive in the past, we will get the X-ray. Yeah, we will get the results for the X-ray.
The X-ray is effective in identifying active tuberculosis in the chest. Tuberculosis can exist elsewhere in the body. It's less common, but it can. The skin test, if it turns out after subsequent testing that the medical belief is, yes, this was tuberculosis caused the positive skin test, that means you've been exposed. Many people have had a course of tuberculosis medication that dramatically reduces the risk of future tuberculosis. If you've not had that, that's a consideration, particularly in the younger population. So it's a little bit of complex decision-making that needs to go through the physician. To avoid the contagious person who can spread tuberculosis by a cough, chest X-ray is very effective. But there are other things to be considered.
Thank you. Thank you. Yes, any other question? Okay, I'm just going to cover our flyer, our handout. And just to we know again, the flu season started already, and it's going to go towards our spring time. So we're going to make sure that if you are feeling sick, you're coughing, to use the appropriate technique. We are required by the Centers of Medicare to post that at the entrance of the healthcare area, to knowing that we are following their guidelines. This is a guideline they want us to do. They want us to make sure that if we sneeze, cough, we cover ourselves with our arm, not with our hands, because then we are going to be touching, like my daughter, everything. I want to make sure of that. Okay. Any questions on this handout? No? Well, thank you so much for your attention. I appreciate it. I want to touch it.
You're good.